everyone. Welcome to our Farmer Talk session focused on insulin delivery. My name is Christina Chu. I'm the Senior Manager of Product Awareness Services here at McKesson. It's my pleasure to introduce to you our session sponsor and speakers from Insulet, Chris Evans, National Account Manager of Trade and Sales, and Ryan Lombardo, Territory Manager of HCP Sales. Team, I'll turn it over to you.
Christina, thank you so much. Can you guys hear me? Darcy? Hello. Is that better?
Oh, I can hear you now.
Okay.
Yep.
Hi, everyone. Christina, thank you for the introduction. It's an absolute honor to be here today. Did you know that the 2025 ADA Standards of Care in Diabetes emphasize and expanded and created earlier recommendation for diabetes technology? We're here today to teach you more all about that. AID, or automated insulin delivery, really is the future. Importantly, we feel that these recommendations by the ADA for both type 1 and type 2 diabetes, for patients, of course, type 2 on multiple daily injections, for those who can safely use, we feel that this is paving the way. And today, my promise to you is that you will leave our time together understanding better the vital role that your pharmacy plays in teaching, educating, and expanding better outcomes for patients with type 1 and type 2, now type 2 diabetes, with automated insulin delivery. Disclosure, very important. Did I leave it up long enough? Thank you, McKesson. Let's dive in. Today I've brought a special guest. His name is Ryan Lombardo from Nebraska, and he and I are going to go over some very important developments that have happened this past year. During this extraordinary year, Omnipod 5 has expanded their indication from type 1 to now both type 1 and type 2. We've added more patient choice for CGM sensor. We launched with only Dexcom G6, but today we have CGM sensor of choice for patients. They can use Dexcom's G6, Dexcom's G7, or Freestyle Libre 2 Plus. Lastly, but most importantly, Omnipod 5 can now be driven by a single device. iOS compatibility was added this year. It was the single thing people were asking for the most.
Every day, yes.
Every day.
Yes, every day.
iOS adaptability now expands our smartphone interoperability to both Apple's iPhone and a long list of Android smartphones. So let's learn a little more from my friend, Ryan Lombardo.
Thank you all for having me here. I just want to tell you a little story about myself. I've been living with type 1 diabetes for now 36 years. Previously, from coming into Omnipod and working here for about 4 years, I had never been on an insulin pump per se. A success story for myself, I was in the mid-8s, 8.5 for my A1Cs, and I live down in the lower 5s now, so 5.2 was my last A1C. Just for myself, it makes having diabetes a lot more simple for myself. And now, more importantly, just over a month ago, my son, he was 16 years old at the time, he's now 17, was just diagnosed with type 1 diabetes. So it really lessened my worry about myself. It's now focus has all been on him. And it was really rough to watch him start off taking some injections, having to take finger pokes, and maybe I shed a few tears during those times. But I was able to get him on Omnipod 5 within 2 weeks, and I'm happy to say he's now 77% time in range,
Wow.
And he's had 0% lows. As a parent, that's so important because watching someone have a low is just not a very enjoyable time. And really, I want to send a special thanks out to McKesson and every pharmacist here that's able to give Omnipod refills on a daily basis, because it truly is a life-saving device that's really out there helping patients, making managing diabetes every day a lot more simple. So let me go into this. We actually just had a type 2 pivotal study, one of the largest and most diverse studies that was out there. It was 305 patients with type 2 diabetes. And as you can see up here, we looked at some of the white, non-Hispanic, non-Latinos, had a drop of 0.7 percentage in A1C. This was all over a 13-week period. And if you go over to the black, non-Hispanic, and Latinos, we had a reduction of 0.8 on the A1C. And if you look at the Latino and Hispanic, it was a 1.2 drop in A1C. A really nice fact overall, our study was a 0.8% reduction in A1C, but with any patient that had an A1C of 9 or above, we saw a 2.1 reduction in their A1C. And what's really nice about Omnipod is a lot of the times when they switch to our device, they're putting this device in areas where they haven't previously given insulin. So actually, almost 30% reduction of total daily insulin happens with Omnipods just because of the site is fresh, we don't have any scarring and tissues, and also it delivers the insulin at a much slower rate than a multi-daily injection. So I'd like to pass it back over to Chris.
Ryan, thank you for sharing your story. Your pharmacy plays such a critical role in the ability for patients to receive automated insulin delivery. And this is fairly new pharmacy benefit for this space. So I really just want to emphasize and point out that pharmacy benefit has allowed AID and automated insulin delivery to flow through McKesson to your pharmacy to the patient hands. So what's new? The future of insulin delivery is available through McKesson at your pharmacy. That's your key takeaway. And it's easy to access, it's easy to adjudicate, and it's easy for patients, simple for them to use in their own hands. This is a very simple product. The technology is impressive. Don't let the technology make you feel like it's complicated. It is incredibly simple to use. So, what do you do in your pharmacy? We talked about the important role that you play. Well, you can order through McKesson. We are slotted in SRC, and that feeds all of our forward distribution centers. In those distribution centers are the intro kit that includes everything you need to start therapy for 30 days, and then the refill pods, a 5-count box available through McKesson. The second thing is when processing the prescriptions for Omnipod 5, please run the intro kit first. When you run that intro kit first, you're going to be able to avoid a lot of hiccups, cancellations, reruns, et cetera, et cetera. You're going to be able to more effectively communicate with the insurance to make sure that it is a smooth process and a quicker onboarding for your patients. And lastly, I want you to understand that the patient on that first fill, I would encourage you, I would emphasize, and please welcome you to be part of their onboarding. In that intro kit is everything they need to start, but sometimes the patient takes it home, leaves it in the trunk of the car, puts it under a file of something in their house. Encourage them to open the intro kit box. Inside that box is a controller. It takes a few minutes to register. As soon as they register, they could even do it in pharmacy if you would encourage them to do that. When they register, they will immediately be added to the insulin training queue. We have a field team of clinical specialists that are on call and we'll contact them directly in order to schedule that hands-on training. If they're eligible, their provider may actually approve them for virtual training, but that is up to the discretion of their provider, okay? But importantly, it starts with getting in the training queue. The faster they're registered, the faster they're in the training queue, the faster they're training, and the faster they're on therapy, which we know will improve outcomes. So I'd like to conclude with OP5 is simple to use, it's very accessible, and incredibly affordable. The average copayment for a patient on Omnipod 5 therapy is $30 per month. We have great commercial coverage. We're recently added to FSS, so all of the government employees are eligible, and you can pull that product right through McKesson. We have government-only products slotted and in distribution at McKesson. Lastly, I'd like to highlight that Medicare Part D equals done. Medicare Part D is the coverage for Omnipod 5. So where some of our CGM partners, et cetera, are more Part B, whereas meters and strips might be Medicare Part B, just remember that OP5 is Medicare Part D. We have exceptional coverage on that. Medicare, Medicaid, commercial, we've got you covered. Over 300 million lives covered in the US. The last thing I'd like to add is that over 42,000 US pharmacies have dispensed Omnipod 5 in the past 12 months. If you haven't, your pharmacy's coming soon. Lastly, may I ask you to please have a discussion with your next MDI patient, multiple daily injection patient. Ask them if they've heard or know about Omnipod 5 and the incredible value and future outcomes that we can deliver for them through your pharmacy. Whoop. That's why I'm done. There you go. So we'd like to turn over to you guys. We've saved a lot of extra time because really we came here for you. If there's any questions, we'd like to answer them now.
Is it on? Okay. We have
Hi
several
there.
patients that are on this, and some people change the pod once every 3 days. Some people change it 2 days. Some people change it one. Is that based on the amount of insulin that they are using? So what is the capability of like a daily use?
So I'm first going to give you an answer from a distribution level, and then Ryan's going to give you an answer from a clinical level, okay? So yes, on this incredible detail aid that's included in every single one of your folders of collateral, and I would encourage you to tape this up at your pharmacy terminal, are all of the directions that tell you what is the best way to fill how many boxes for a 2-day change versus a 3-day change. Most of the Omnipod 5 population is a 3-day change. One single pod can replace up to 14 injections over the course of 3 days, and that's the norm. But we all have exceptions, and there are patients that require additional insulin, so they require a 2-day change. It does matter how many boxes you're dispensing for the month. So please reference this from a distribution standpoint. I'm going to now turn it over to Ryan because he has some clinical response to that question as well.
So a good response to that is originally when a provider will look at their total daily insulin to come up with what the appropriate is, just like she said, it's usually 2 boxes of 5, which is a change every 3 days. Insurances, I won't say all insurances, but they don't differentiate between a 3-day pod change, a 2-day pod change, or a daily. So it really depends on that specific insurance if it will change a copay, but on a normal circumstance, it's going to be the same copay. So it's whatever the original prescription is written by the provider. There are many times where a provider may think a patient has taken X amount of insulin, but once they have the proof of wearing Omnipod 5, because you can see how much insulin they're using every day, they could change to a 2-day pod change or a 1-day pod change. I've seen a patient that was taking approximately about 300 TDI per day. They ended up only utilizing 75 units per day. So they ended up getting to be able to, where you'd think they'd have to change even more frequent than once per day, ended up being a 3-day change. So you'll see that prescriptions could change, mainly because of that 30% reduction in total daily insulin.
Yeah. There's such an important improvement in quality of life when patients are able to single use a short-acting insulin versus juggling short and long, right, with MDI therapy. Of course, it's important to have always your emergency and backup supplies, but there's the pod change and highlighted that it's short-acting insulin being dosed a microdose every 5 minutes is a great important emphasis. And thank you for calling that out, the pods. What other questions are on the top of your mind? Please, we're here for you. Okay. I won't call on anyone because that's not fun. Hi, Michelle. She's my new best friend. We met this show.
I was just asking, you're supposed to be able to wear it at any time, taking the shower, going to the pool, all that kind
Correct.
of stuff. Is that okay temperature-wise with insulin? Like, you're wearing it for 3 days and you're just taking a hot shower?
Such a great question. Go ahead.
100%. So in my time, I've only had one pod fall off in 3 years now. It was on a ropes course on an actual wire. So it actually got caught on the wire. But other than that, it really depends on the patient. But once I put on my Omnipod, I treat it like that's my pancreas. And I don't want to take my pancreas off and turn it off ever.
Right.
So I keep it on no matter what. And my son now changes his pod in the shower just to make it a little bit easier to take on and off. And then Dad gets to help him put it on. So I was lucky enough, an hour before we started out here, I went in there to help him change his CGM and his Omnipod. So
Over the
he got
phone.
to do it on his own, over the phone.
Yeah.
So he was a little nervous, and he's like, "Oh yeah, it doesn't hurt." But
Yeah.
it's neat to see that day in and day out. But you really don't have to take it off. Seen scuba divers wear it, swimmers. They want to keep their insulin delivery all the time. So thanks for the question.
The feature of Omnipod 5, that it's tubeless, provides incredible freedom to patients that are wearing the product. And I mean, really, we hear stories every day. We just heard a story at lunch about a patient who upgraded from a tubed to a tubeless Omnipod 5 insulin pump because at their employment, they worked in a casino, and the tubes were always getting caught on the slot machines as they were doing their work. It's the little things that we take for granted when your pancreas is inside your body. But we're so proud to offer that convenience and freedom, waterproof, ability to swim, ability to shower. There's so many incredible features and benefits for your patrons, for your patients that you help serve. And we're incredibly grateful that you've taken the knowledge in from our presentation today and that you'll be that conduit. You know where you can get product. You know that we're covered. And please also know, on the back of the box is our 800 number. We actually have very short wait times. Don't be afraid to call us. We're not a payer. Please call us if you need us for anything. If you have questions on product knowledge, coverage, or if a customer is ever requiring extra help, we're there for you. 24/7, 365. Okay. I'd like to welcome you all over to our booth. I feel like we're running out of time, and I feel like we have so much more to share. If you'd like a hands-on demonstration of Omnipod 5, our booth is right here. It's booth number 1219. You can see the nice purple tablecloth at the end of the aisle. Please come see us. Inside the folder is more than enough literature that you'd ever need to support this product, how to order through McKesson, and importantly, in the little box is what we call the patient experience kit. The patient experience kit will give you the opportunity to wear a pod for up to 3 days and understand how gentle our proprietary adhesive is, and also how easy it is to forget that you're wearing Omnipod 5. There's no real insulin on board. I think there might be sand in there, but there's something in there to weight it so that it's the same weight as if it had insulin in the pod. And it just gives you the experience so that you can talk to your patients more eloquently about Omnipod 5 therapy and how easy and simple it is. Is there anything else I can do for you guys today? Please. I love your Nashville sweatshirt. I need one before I go home. I can't hear you. I really do want to hear you.
Oh, I think that one's locked.
How about that?
It's
Sorry,
the end of the
yes.
day. These batteries are running low.
It was the first shop I went to. I was quite cold.
Oh.
You mentioned scuba diving. We just got out of the scuba business. I had asked a rep or someone earlier about using for divers, and I think he had told me there was a depth, fairly shallow limitation on it.
Yeah, so
Is-
So I remember you
Yeah.
from last year. Yeah, so welcome back. Thank you for coming. Please,
So up-
we just
up-
talked about this at lunch.
So I guess maybe more shallow. You must have done some deep diving, but it's 25 feet for up to 60 minutes.
Okay.
So, and you could visit us over the booth. I have plenty of stories to share with you. So, and I'm
That's
not
so
a scuba
exciting.
diver, so no, I've never scuba
But
dived.
I think it's so exciting that our McKesson supplied pharmacists are going on these exotic vacations. Take me to Belize.
Yeah. Last year, you said that we were on the cusp of a cure for diabetes 1. Did you not say that?
No, I'm
Nope.
sorry. No, I'm sorry.
She dreams a lot.
But you know
I've
what?
had the same dreams.
Yeah,
Just
I'm
believe
sorry.
me.
No,
I'd rather
I-
find a new job than have that happen. So
I'm trying
yes,
to
that's
gently find a way to assure you that I 100% did not say that. But I'm saying it in the nicest way possible. But I'm absolutely certain that I would never say that. But I do believe that there's considerable hope, and I hope to see the day that that will actually be the case. There is a new drug for delay of onset.
I don't know the name of it. I
Yes,
saw it at the
there is
ADA, but
yeah.
yes, they say on average it can delay it from 1 to 2 years. So you'd be doing testing for
Yes.
parents and that may think that their kids have that. So it's the test that can delay the onset. So
But unfortunately, I'd have to Google it for you, and I'm happy to do it at the booth. I don't know the name of the pharma company that is producing or distributing that drug, but what I can share is there's considerable hope. So much hope in this space. When I, think about 20, 30 years ago and where we are today, it's absolutely incredible. So thank you for asking, and I'm glad we clarified that. Yeah, thank you. I think we're good.
Think we're good.
Okay. Thank you. I'll
Thank
see
you.
you all at booth number 1219. Please come see us.